Let me begin by thanking Okazi and CARE for putting together today's workshop. I think it's incredibly important that we get together and have these kind of conversations, and I look forward to not just speaking from up here, but having a chance to speak with people afterwards. I think it's important because IEHPs, internationally educated health professionals, have some incredible skills that aren't really being put to very good use in Ontario overall. We're doing better, but in our work we see many people with a great deal of experience, expertise, education that are wanting to make a contribution and having difficulty moving forward on their path to practice, and in some instances having difficulty moving forward into an alternative career as well. So I welcome the opportunity for us to work together and to strengthen the work that needs to be done to help IEHPs succeed, and through their success to improve the health of Ontarians. As was noted, the Access Centre, a little bit of history. Oh, the slides up, good. So history for the Access Centre, as noted, we got started in 2006, really started seeing people in 2007. In 2006, the Ministry of Health brought together stakeholders from across the province, settlement agencies, bridging programs, regulatory colleges, and in a one-day workshop basically asked people, what's the most important thing that we can provide to IEHPs right now? And the overwhelming consensus was there needed to be a one-stop shop, a place where people could go and get help navigating their path to practice. So through that consensus, the Access Centre was established. And we were established as a program, as it says on the slide, of the Health First Ontario Marketing Recruitment Agency, which also began at that time. And the agency provides a wide range of health human resource work. The mandate is basically to be the operational service agency for the Ministry of Health's Health and Human Resource Strategy Division. So we take the policies that are developed there and then try to make them happen. Funded by the Ministry of Health with an independent board, there's, as I noted, a wide range of programs and services, from finding doctors to fill gaps in northern and rural Ontario, to implementing the province's physician assistant program, to job fairs for nurses and allied health professionals, and of course our work with the IHPs, which we'll focus on now. And okay, so these are our clients. These are the regulated health professions in Ontario at present. And you can see there's a good long list of them there. And as Nushat mentioned, there's a number of transitional councils that are, well, that doesn't come up very well, does it? The group on the right should be saying homeopaths, kinesiologists, naturopaths, physiotherapists and registered mental health therapists, and traditional Chinese medicine practitioners and acupuncturists. These professions all have transitional councils at present that are developing regulations and standards so that they will become regulated. That says 3 more minutes. Oh my. Okay. So it's a long list, obviously, and the path of practice is different for each of these professions. So we're in the business of helping the IHPs navigate that path. So in what ways do we do that? The services we offer are here. Information is a critical part of what we're providing, and we try and do that in as accessible a way as possible. So in addition to our speaking with people in one-on-one sessions and group sessions, there's a great deal of information online at our website, and I would encourage people to have a look at what's there. And we've also moved towards doing webinars. Because while 85% of Ontario's IHPs live in or around the GTA, there's thousands that live in Windsor, Niagara, and Ottawa. And in fact, the webinars go beyond that, and we've been working with CIIP, the Canadian Immigration Integration Project, to provide webinars to doctors and nurses thus far who are pre-arrival and are currently in cities and countries all across the world. Resources include our library, where there's lots of books and study guides for all of the IHPs. And in fact, Christine's group recently sent over a big bundle of new books for laboratory technologists that are incredibly helpful for them. Counseling is really, supportive counseling is really the key service that we provide. And we do that through group sessions and through a lot of individual support. Our advisors are highly trained, and they do include helping people with alternative careers. We also do a lot of referrals to regulatory colleges for specific information, to bridging programs to help people get the training they need to upgrade in some cases. Language skills, as you all know, is incredibly important. And we see a lot of people who have recently arrived, and so we make quite a few connections to settlement agencies for a wide range of services that people need. That might be a little challenging to see as well, but this gives you a sense of the people we've been seeing and the numbers. So since December of 2006, we've registered over 22,000 internationally educated health professionals. Currently, there's over 300 people a month that are registering with us. Physicians have, since the beginning, made up about 75% of that group. And as you likely know, it's a significant challenge, and as Ms. Hatt mentioned, it's quite competitive to become licensed as a physician in Ontario. So it's not surprising that they find their way to our door. I have 1 minute. Thank you, Jasmine. Nurses make up 10% of the overall client group, and we work with them until they get their letter of direction from the College of Nurses of Ontario, and then typically we will refer them over to care, where post that letter of direction gets picked up. Pharmacists make up about 5% of our current client group, and pharmacist assistants is an interesting non-regulated profession that works as a very possible career alternative for them. Dentists, Ms. Hatt mentioned, they're a large group, and it's particularly challenging for the dentist because there aren't that many practices available, and they have to do a lot of retraining typically. So I was asked to speak quickly about labor market conditions for these professions, and it's quite varied. And I won't pretend to tell you that the Ministry of Health has a perfect handle on how many doctors or nurses or any of the other regulated professions we need. And it varies. There's likely a significant group of people who will be retiring in the coming years. It's very hard to gauge that. What I can tell you is that the distribution is a challenge across the country, across the province. Most of the people who graduate, both in Ontario or Canada or from outside of Canada, are interested in being in an urban environment, and the GTA is really a strong interest for them. But many of the positions are in more northern and rural areas. And so some of our work is to try and encourage people to consider that type of alternative. And that's a challenge culturally for people, but I think worthwhile considering given the opportunities that are there. I'm going to stop here and simply end by saying I think there's some really important work that we could do together, and I think while some of that's happening, there's more that we could do, and I look forward to our doing just that. We have some brochures that are in the back. It's got contact email information in it, and our website's also there. So I will close by saying thank you. And questions, well, I guess will come at the end. I look forward to that as well. Thanks a lot.